Good afternoon, everybody. Thank you for joining us to hear more about the Puerto Rico healthcare crisis. Today, Dr. Johnny Rulan, Puerto Rico's former health commissioner, and Ricardo Rivera, the executive director of Puerto Rico's the Puerto Rico Health Insurance Administration, will provide an update on the state of affairs as the system continues to face significant challenges. Following Dr. Rulan and Mr. Rivera's remarks, we'll have time for Q&A that will include the other healthcare experts, providers, hospitals, and insurers we have assembled today. Thank you again, and with that, I turn it over to Dr. Rulan.
Yes, hi, and thank you for this opportunity to display the Puerto Rico crisis situation. As many as you know, we're U.S. citizens for 99 years now, and we have been complying with all our requirements as U.S. citizens, going to war and doing all the requirements of all the other U.S. citizens. However, when it comes to health care, we have to follow all the regulations from the FDA, from the Joint Commission, from all our boards, and everything that is federal. We have the mandate in Puerto Rico, yet we get a third or half of the funding. As an example, we have the same requirements for Social Security, and we pay the same Social Security, but at the same time we get the same benefits. For Medicare, it doesn't happen that way. We pay the same amount as anybody in the mainland for Medicare, yet when it comes to benefits, we get half of the benefits. So that's something that in Puerto Rico we have no long-term care, no low-income subsidy, there's no supplemental security income, and our premiums are around half of what you get paid in the premium for in the mainland United States. When it comes to Medicaid, of the 50 years that Medicaid and Medicare celebrated this year at CMS, Puerto Rico has participated fully the first 2 years, 1965 and 1966. Since 1967 till today, we've been capped at around 15% federal, 85% state. In a comparison, a rich state pays 50% federal and then 50% state. A poor state like Mississippi and Alabama, they pay 13% or 10% state and 90% or 87% federal. In Puerto Rico, it's the opposite. We pay 85% state and 15% federal. Of the $72 billion that we have in deficit that has the financial crisis and now becoming a humanitarian crisis, more than 40% of that debt is due to health care and the lack of funding from Medicaid. So it has a name to it. So if we fix the Medicaid cap situation and put us at the equal of Oregon, instead of getting $1 billion or $1.4 billion, we'd be able to get up to $6 billion, and that would get rid of all the problems that we have in the funding for the rest of the programs in Puerto Rico. So it is an essential part of the financial crisis, and it's important that we recognize it. As an example, if you have a hospital in the States, and usually you have one nurse for 4 patients. In Puerto Rico, that doesn't happen. You have one nurse or 2 nurses per floor. So that's one nurse for 20 patients. If you want your mother or your sister or your daughter to get direct care, you have to pay for a private nurse to stay there with her that night. That same thing happens for the long-term care. If you want help for your mother or in case of a handicapped child, you have to pay for it cash. More than 50% of health care in Puerto Rico is paid for by cash. And basically the amount of money that we're pouring in to the healthcare system in respect to other parts of our budget is just too much. When it comes to the requirements for Medicare regulation and for the 5-star system or for whatever it is that we have to compete with the same requirements, and yet at the same time we deliver the services for a third of the price. So you're saying, well, why can't the United States do it for half the price? And what we're saying is if the U.S. can do it a little bit lower and we go up a little higher, that's probably the medium. So the per capita in the U.S. mainland is $9,000 per patient per year. In Puerto Rico, it's $3,000 per patient per year. We think perhaps at around $6,000 per patient per year would probably be where we have the triad of better quality, better care at affordable cost. I'm going to pass it now to Ricardo Rivera. He's the director of the Medicaid program in Puerto Rico and the implications that it's having into our Medicaid not having stability and having the cliff approaching in October 2017. So with you, Ricardo Rivera.
Thank you, Johnny. Like Johnny said, I am the executive director for the Puerto Rico Health Insurance Administration, which is the government agency that handles and executes all the Medicaid program in Puerto Rico. We cover or we service 1.6 million Puerto Ricans. That's almost 47% of the population of Puerto Rico is served through Medicaid. And the system costs $2.8 billion a year. For us, this crisis, we always say that we are amidst a human crisis, soon to become a human catastrophe if the federal government doesn't intervene. And why do I say that? Because first, we are treated different than any other jurisdiction in the U.S. Like Johnny said, we are capped. Our medical assistance program is capped at $300 million. Then we have CHIP, which is close to $130 million additional, and then everything else has to be covered by the local government. If it wasn't, because in the Affordable Care Act enactment, $6.4 billion were assigned to Puerto Rico, but they are a non-recurrent block. So as soon as they are depleted, and that date will be December 2017, we are going to be again in the position, or the central government of Puerto Rico will be in the position to pay for those monies, but the difference between today and 10 years ago is the fact that the central government is going through a fiscal crisis as well, and they already defaulted in the payment to the bondholders that they were supposed to have in May, and that has a direct impact in the program that I run, because the majority of the funds, or of the local funds, come from an appropriation from the central government budget. So as those funds do not flow into the agency, then I cannot match it with the federal government funds. So and just to illustrate that, in April, right before the default of the Commonwealth, the monies that I received from the Department of Treasury and from the municipalities of Puerto Rico to contribute to the plan or to the program, they were disrupted, and that caused a chain reaction that even all of the MCOs, all the managed care organizations that are contracted to provide the services, they wrote letters to me. Molina Healthcare was the one that made it publicly, because they are a public institution, publicly traded, but the others sent also letters to me saying, we cannot withstand no payment scenario from the central government and from your agency, so if this is not solved, we are going to halt the services. And that would be catastrophic, because we are talking about 1.6 million people that receive the services through this program. And besides that, they are not the healthiest people. They have many chronic conditions that we need to handle, and that we handle every day. So that's from one end some stress that this fiscal situation and the health crisis is causing is exerting into the program, and the other is the regulations that we need to comply, but without the benefits. And just an example of that is the health insurance tax, or the health provider fee, that from in the Affordable Care Act was enacted to bring funds to subsidize the exchanges and the subsidies that are provided through the exchanges. But guess what? We have to pay for that money, but we don't receive the benefits because Puerto Rico is excluded from the exchanges and all the subsidies. Puerto Rico is excluded from the individual mandate, from the corporate mandate. So all of the benefits for which that tax was supposed to cover, we don't receive. And the impact to the government health plan or the Medicaid program here in Puerto Rico is we estimate that the impact this year will be like approximately $65 million that we don't have. We barely have to pay the premium on a monthly basis. Another example, due to this situation and the disparity, back in April 2015, we lost a line of credit that we use in order to maintain the operations flowing and to manage the different sources of income that comes at different times. But then all of a sudden, in March of 2015, not even the private banking nor the government development bank was able to continue with the line of credit. So all of a sudden, it's the first time in 22 years of the program that we need to operate on a daily basis without a line of credit, and that translates into delays in payments, that translates into providers that are suffering because they are not receiving the money, which in turn incentivizes the migration of professionals in the healthcare industry. And we are losing physicians, but we are losing nurses, we are losing technicians, we are losing everybody. And that creates a lack of access among the beneficiaries. And now for appointments, sometimes the lead time is a year, which is totally unacceptable, but it is because we don't have, in some specialties and subspecialties, we don't have enough physicians, not only to cover the government plan, to cover the commercial and the Medicare, because all of them share the same providers, because we are a small island, so there's not enough people to be in different segments. They all cover all the segments. So that's something additionally that we are experiencing, and it preoccupies us because time is of essence and time is running out. And I sometimes I feel when I speak with Congress people and with people from the administration or the presidential administration, sometimes I think that they believe that we are joking, and we are not joking. This is a serious matter, and it needs intervention. It needs intervention quickly.
Thank you, Mr. Rivera. I would like to ask Richard, our operator, to alert you to how you can participate in the Q&A section, and then also invite Mr. Elliot Pacheco, the former president of the Puerto Rican Pharmaceutical Association, to talk about the crisis from the perspective of pharmacists. Thank you.
Thank you.
Hi.
For any questions on the line, if you have a question, please press star, then 1 on your touch-tone phone. And if you wish to be removed from the queue, please press the pound sign or the hash key.
Go ahead, Mr. Pacheco.
Okay, thank you. As Dr. Ruyan told you, we pay for Medicare and Medicaid, but we don't get the same benefits. And as you all guys know, the Medicare program works as an accumulation program. Once they reach the threshold, that is $3,000 yearly, they have to pay 50% of the cost of the drugs. If they move to the states, what will happen in the state is that then a special assistance program is activated, and it's called the low-income subsidy. Puerto Rico was excluded from the low-income subsidy by legislation, but in 2008, the administration promised to work a phasing extension for the LIS enrollees on the island, for the low-income subsidy expansion on the island. And that never happened. It was an empty promise, like all the politicians do every 4 years. What is happening with the patients in Puerto Rico once they reach their threshold, and that is occurring most of the time is around June, July, August. So patients, they are splitting the drugs. They are taking the drugs every other day, and they have to decide whether they pay for the medicines or they pay for the electricity, for the rent, or for the other bills that they have. And lastly, they don't take the drugs. They don't take their medicines. And the effect of that is that people, as you all know, people are moving to the States. When they reach Florida or reach the New York, the LIS is activated immediately. There is like two planes leaving the island daily, full of people going to the States. So we have more people visiting the emergency rooms and getting hospitalized. And lastly, people are dying. They don't have access to their insulin. They don't have access to their hypertension drugs. That's why, as Dr. Ruyan was telling you guys, this is a humanitarian crisis. So that's it.
Yeah, I'd like to add, this is Dr. Ruyan again. Don't forget that, we're U.S. citizens. And by being U.S. citizens, we can move anywhere freely in the United States. So we take advantage of going places where we have more benefits. But at the same time, all the other providers that are looking for a bilingual nurse or a doctor that has very good clinical training, the brain drain that we're losing every day, that we lose the very well trained healthcare providers, puts an indent in our system and gets them unbalanced. So not only is it that we're moving for some benefits over there because we can do it as U.S. citizens, the fact of the matter is that at the end of the day, the U.S. is going to suffer because instead of paying for $3,000 a year here per patient, they're going to have to pay $9,000 a year per patient in the States, and that's, we're talking about perhaps 65 to 70,000 new people every year moving to the States, in addition to the one doctor per day that moves there. So there's a lot of brain drain, but at the same time, it's not good to damage a system where basically what we're asking for is, if you give us the right tools, we want to fix it here. We don't want to move to the States. Many of us were born and raised here, and we want to stay here.
Again, for any questions, that's star then one on your touch-tone phone.
Yeah. I'd like to invite Domingo Cruz, the CEO of the San Jorge Children's Hospital, to make a few remarks. It sounds like we lost Mr. Cruz.
Mr. Cruz, if your line's muted, can you please unmute?
Are you there now?
Thank you.
Yep, there you go.
Okay, I have muted. Yes. Good afternoon, everyone. Domingo Cruz from San Jorge Children's Hospital in San Juan, Puerto Rico. Also, I was a past president of the Hospital Association until 2015. As a healthcare industry, we are very concerned about what is happening in Puerto Rico the last 10 years with the recession, but especially the last 12 to 18 months. As Dr. Ruyan mentioned and Ricardo Rivera, the industry is hurting. Just to give you an example, 10 years ago, San Jorge Children's Hospital, we used to have 80% of commercial insurance patients and 20% Medicaid. 10 years later, because of the economic situation in Puerto Rico, we have approximately 50% Medicaid and 50% commercial. So the island, because of the economic situation, and the providers are heavily dependent on the Medicaid program as well as the Medicare program. Of those that are Medicare, 80% of the Medicare patients are also Medicaid. And between the Medicaid and the Medicare, that represents about 80% of the utilization of the healthcare services today. So that puts a lot of pressure on the providers, and that puts a lot of pressure on the local government. As Dr. Ruyan mentioned and Ricardo Rivera, the Medicaid program is not properly funded. We receive approximately 20% of the funds what a state receives. So therefore, that puts a lot of pressure on the Puerto Rico government to fund that particular program. Because of the economic situation that we have today, there is numbers from the College of Physicians that a physician is leaving the island to the state at the rate of one per day. Approximately 365 physicians are leaving the island per day. As Rivera mentioned, just to give you an example, on the local newspaper, the Leon Group from Miami is placing ads in order to relocate physicians to Miami, Florida. There is another ad from a group in Kissimmee, Florida, that is also advertising a position for healthcare professionals from Puerto Rico to go to Kissimmee without a Florida license, because Kissimmee has been assigned as an emergency state territory. So you're able to move over there with a Florida license and practice medicine. Just 2 weeks ago, someone that I know called me because they needed adult rheumatology, and the waiting to get to see adult rheumatology was 6 months. So he wanted to see if I can help him out, if I know somebody to help him out. Just last week, one of my employees called me up because they need to see an adult endocrinologist because the wait was 1 year, 12 months. So if the trend continues, you either die or you get sick before you are able to get a physician. So the situation is getting very critical. As far as the hospitals, the system is putting a lot of pressure on the hospitals. We have estimated as a hospital association that the industry has lost about 5,000 jobs between freeze position and people that have been laid off. Just to give you an example, just recently on the local newspaper, there was a hospital that announced that they were laying off close to 500 employees. Another hospital in San Juan, Auxilio Mutuo, a very known hospital, also announced that they were laying off 200 employees. A hospital nearby, a very well-known hospital, Ashford Presbyterian, they lost money last year and they were not able to give the Christmas bonus. Another hospital in Caguas, very well-known hospital, IMA San Pablo, they also lost money and they announced that they were not able to give the Christmas bonus either. So we have seen on the press recently that the power company have threatened hospitals to cut off electricity. Hospital like Teachers Hospital, San Juan Health Center, Santa Rosa Hospital. Santa Rosa Hospital, the power company, cut the electricity while they have patients hospitalized. And they had to go to court to get a judge to order the power company to put back the electricity. We have hospitals that in 2015 filed for bankruptcy for reorganization. Dr. Wilma Vasquez, Hospital Castañer, Damas Hospital, Lafayette. So the situation right now is very critical. As Ricardo Rivera mentioned, next year we have what is called the Medicaid cliff. And as we have been mentioning, 45% of the population today is Medicaid eligible, which that means is that about 40% of our income provides from the Medicaid program as an average throughout the island. So if we happen to go from $1.4 billion back to $400 million, the system will collapse. There is no hospital that can all of a sudden can stay open if 40% of the business is not available. So as far as Ricardo Rivera, I would imagine that with $400 million versus $1.4 billion, he's going to have to kick people out of the program. He's going to have to cut benefits. And all of that will definitely impact providers. I mean, there is no way that he can provide the same type of coverage to the same number of people going from 1.4 to $400 million. So last year, Medicaid was not able to pay us $250 million, and that really hurt the industry as a whole. As Ricardo Rivera mentioned, he lost his line of credit that he used to keep up with the payments, and because of the economic situation, they lost the line of credit. I mean, in general, the government doesn't have a line of credit right now. The government cannot go to the market to get financing. So right now, the government is paying for whatever with the money that is coming in, as the money is coming in. So if for some reason all of a sudden the money is not coming in for whatever, they have right now it's happening. They have to choose. They have to select who are they going to pay today, and that's a problem that the local IRS has. Who is going to get paid today? That's a decision that they have every day. In general, the healthcare industry is a local industry. So every dollar that you put into this industry stays in Puerto Rico. It not only provides an essential service as healthcare is, but it's also an engine, it's also an instrument to help the economy. Right now, healthcare represents 20% of the GNP. So if for some reason, again, the system is affected or the system collapses, the island will collapse. And I have no question that thousands and millions of people will have to move to the U.S. because if there are no health care services, you cannot stay on the island. I can give you an example. Every time a big company moves to Puerto Rico, they come to my hospital. They want to see where the employees, their executives, are going to go in case that they need health care. They visit schools. They see the security. They check the crime rate. And those are all decisions that a company evaluates before they move to a particular territory. So in general, the situation is very concerning. We are. I have talked to Rivera weekly, because sometimes he has been behind on payments, and I have expressed to him that the system is very fragile, and the system and providers could fail if they don't keep up with the payments on time. We are on a very difficult situation here in Puerto Rico, and unless something happens and we see some changes on the Medicaid, on the Medicare, and we have some type of incentive coming from the federal government to create more jobs, we are not going to get out of this circle.
Thank you for your remarks. For any questions, again, that's star then one on your touch-tone phones.
Great. And I would like to invite Dr. Ivan Vega to provide a perspective from the as someone who works with insurance companies. Thank you.
Hi, thank you. Just taking in consideration also the population profile that we have here in Puerto Rico and talking specifically about the population 65 years of age and above, we do have almost 37% of our population has diabetes as condition. So as you know, this condition has a lot of complications, has correlations and comorbidities with cardiovascular diseases. So it's a population that it's highly complex. We do have around a little over 15%, 5% of our population has any type of pulmonary disease. Cancer is also another of the diseases that we do have as a trend here in Puerto Rico. Also, mental health, which is highly related to managing and controlling diabetes. It's also a high percentage, especially in that population. Now, all these that have been mentioned and all the facts that have been mentioned by the rest of the ones that have speak in the panel, we can see that it does have a social impact. Not only the physicians are migrating, but also the family and the younger population migrating. So what we see is more patients, more members that are elderly who are taking care of elderly population. We have patients who are 85 years of age and are taking care of their 65-year-old sons and daughters, and that's something that it's real that we see on a regular basis because of the social problems that we have here as well. So it comes to a time that sometimes transition of care of a patient from the hospital to their homes is difficult because we don't have where that patient can go back because they don't have who is going to take care of them. That makes more complex administration of medications, controlling the conditions that I have mentioned. So this is another impact for that migration that we have had the past few years. Is not only that we are having problems with access of care because we don't have the physicians, but also that we don't have the population who is going to take care of that elderly population. Another thing that I want to mention that also affects this crisis is that we have a very low adoption of electronic medical records from our providers. So that really makes a little bit of more complex this coordination of care, and it's not only that we do have lower access to care, it's that communication between providers and between the complexity of the system, it's very difficult. So that's another aspect. And going back to what Dr. Lujan mentioned about the impact that this problem has in the States specifically, it's that we have identified, we have some statistics that, for example, in Florida, there are a little over 5,000 homeless people that are from Puerto Rico, because the ones that are leaving Puerto Rico, some of them will have a job, but some of them will not. So they will go to the States just to see what they can find in there, what are the opportunities for me here, and they will end up in the system that it's going to be more costly for you guys, not only from a standpoint of the health system, but also from the social aspect of this situation specifically. So going a little bit back to the statistics, we do have 37% of cardiovascular diseases that also impact the way we treat our patients here in Puerto Rico. So that was some of the things that I wanted to share with you guys.
Yeah, I'd like to add to that. This is Dr. Ruyan again. And this is not something that, we're coming up with now. in May of 2016. The coalition started in April 2015. We had numerous meetings with the executive branch and asked President Obama to intervene. President Obama intervened, understood the problem, and put in February the budget for Congress to approve to get us out of the Medicaid caps in 10 years. Basically, it's a 10-year program, and the cap crisis is to occur in December 2017. That means that we still have over 16 to 18 months to proactively solve the problem. So it's not like we're coming and saying this is something that we never told you. We've been at this now for almost 2 years, and at the end of the crisis, we would have advised everybody that we knew we had to advise with a 30-month check. So 30-month, is important for people to understand that it wasn't something that we just made up at the end.
Thank you. We have a question online from Heather Long from CNN. Please go ahead.
Hi. Yeah, you kind of began to touch on what I wanted to ask about in the last comment. Obviously, this has been on the table, the notion of giving Puerto Rico some aid for the healthcare system, but it's not in the latest bill, at least. But from what I've seen, do you have any hope that you're going to get more funding from the federal government? Is there anything that's giving you all hope on that front?
Well, again,
it seems.
We had five approaches as we went through this. We said we'll do the federal executive approach, and there was a group that went and met with Secretary Burwell on a number of meetings and continues to meet with her. There was one group that is doing the part with the legislatures, and we are visiting the Republican and the Democrat group. We have a lobbying group working with us. We have the legal part of how we perhaps we'll have to go on the legal way here, and then obviously the media and some demo projects that would show why Puerto Rico, with much less funding and all the requirements, has been able to maintain itself all these years relative to the states where they have much more money and the same requirements and what would be the right fix so that there would be a demo project. So all 5 areas are being dealt with as we speak, and we're just hoping that somebody will do like Secretary of Health Burwell came and met with us at the governor's office last month, and she said we just need people to do the right thing, and this is the right thing to do. Puerto Rico should be given equity, and it should be given equity because we're U.S. citizens, because of the fact that we have been left out 48 years. And those 48 years of the 50 that CMS has been operating has given us more than 40% of our deficit. So there's an aim over here for deficit. It has nothing to do with Puerto Rico being irresponsible with their finances. It has to do 100% with Puerto Rico being good to the poor people and giving them health care, even though we didn't have the money, so that everybody here would be at the main table. So I think one of the most important things of the solidarity in Puerto Rico is that we share what we have with all the people here in the island, and that's why we have a pretty good social milieu. But at the same time, we have gone into deficit because of the fact that the Medicaid cap has been promised and has never been eliminated. So we need to make a case that this crisis, this financial crisis, is mainly because of the lack of promise that has been promised in the past of equity and hasn't been solved.
And can you touch a little bit about, obviously the Zika virus is on a lot of people's minds. Do you all feel, or if anybody wants to chime in on whether Puerto Rico isn't able to address that sufficiently because of some of these issues?
Well, absolutely. I mean, the fact that they've been 3 months waiting to give us money for the media campaign, who can wait 3 months in an emergency to be able to do the public service announcements, to be able to do all the training with the budget that we need to go into all the different communities? How are we supposed to do that when there's no money? I get up every morning at 6, 7 in the morning, do all the free media. Today is a free media for all of us as well. We're trying to get you guys to help us without having to pay any money to have any of the educational campaigns. And that's the way we worked on Zika since January. Everything has been on free press because there's no money for media campaigns. There's no money to go into the communities and do the work in an organized way and at all the different grassroots levels. And there's just a lack of sensitivity to understand that when you have an outbreak of this magnitude, where you have a mosquito bite that then amplifies through sexual transmission, at the level that it is spreading all over the Americas and in Puerto Rico included, we have to come up with some major interventions like was done in Africa with Ebola. I mean, and here we are domestic in U.S. and there's been no concern over 3 months of fighting in Congress, and yet one penny has come to Puerto Rico to solve the problem of Zika, and it keeps on spreading.
Are there any additional comments from our speakers on either of Heather's questions before we wrap it up today?
At this time, I see we have no further questions from the audience.
Thank you, everyone, for joining us today. We appreciate your time, and thank you to our speakers. Have a great day.
Thank you, ladies and gentlemen. This concludes today's conference.